Hi everybody, this is Hannibal. I'm going to do this video about wound care. There are 1,001 videos on YouTube about first aid and treating wounds. I've made a few of them myself. You can find them here on my channel. But what do you do after that? You're out in the field, somebody gets injured, they've got a wound, you bring them back. Well, you're probably going to go to a doctor or a hospital. But what if it's a SHTF scenario? There is no hospital, there is no doctor. You've got to take care of them yourself. You've got to get those wounds healed up. A lot more people will die of infection and wounds than malnutrition or any other problem that you're going to have to deal with. So let's learn how to deal with that. And that's what I'm going to show you today. I'm going to show you some tips and tricks I've picked up over many, many years of doing wound care. And I'm also going to share some stuff from this book. This is the Village Medical Manual, a layman's guide to healthcare in developing countries. This is written by Dr. Mary van der Kuy. I'm just going to call her Dr. V from now on. She's Dutch. This is a 2-volume set. The other volume's in the other room. This book is geared towards missionaries going to undeveloped countries. You may not have any medical training whatsoever, but you're still probably the closest thing to a doctor that these people have seen. So she's written this book step by step, how to treat and diagnose and deal with different injuries, illnesses. She teaches how everything from delivering babies to doing circumcisions to mending broken bones in here. A very good book. Written towards the layman, so there's not a lot of medical terminology. It's really geared towards somebody who is going out as a missionary, might have some education, but may not have any medical education whatsoever. But if you're in a village, people get sick, they're going to be looking to you for help. I think this is an excellent reference to have for SHTF stuff for preppers, because in that kind of scenario, it's very similar to what you'll see in undeveloped parts of the world now, practicing in a very austere environment where you don't have a lot of stuff to rely on. There's not a hospital around. You're going to have to treat this yourself, whatever it is. And if there's something that you can't treat, she'll say that. And she'll say if you can't get this person to a hospital, they're probably going to die. Don't waste your time in resources, mending them. But there's a couple of times I'm going to reference this book. And the reason why is I don't want to be accused of working outside of my scope of practice. As a RN, I have a specific scope I can work in. YouTube has edited some videos, they kicked some videos off and stuff. People saying giving bad medical advice and stuff. I have made a lot of training videos over the years. I've trained a lot of nurses, student nurses, precepted them, and made a lot of videos. I've made some here that I've put on for different organizations I've been involved with. And sometimes medical professionals are the worst for piling on. They want to try to show they're the smartest person in the room, which I am not. And they will complain, that's bad advice or your own stuff. So there's a couple of items that I want to say, I'm not saying this. Dr. V is saying this. And when I get to those parts, I will be reading from that book. It might be a little boring watching a video of me reading, but it's good information. I think you're going to enjoy it. So stay tuned. Let's take a look at this wound. Now, this is a prosthetic butt, as you can see. This is something we use at work for training nurses, how to heal pressure ulcers. But a wound is a wound. This could be infected stab wound. This would be a cut for barbed wire. A deep slice from a knife. A wound is a wound. So the location, size is not that important. The same principles apply. You want to get it clean and you want to keep it bacteria free and you want to keep it infection free. So if you have a wound like this, one of the things you want to do is assess it. You want to clean it out. You want to get the gunk out of there. And what you're probably going to use for that is a 4x4. Which they come packaged like this. It's just a 4-inch gauze, 4-inch square. This is what's called a loaf. It's got 200 in here. It's almost empty. I've just got a few left in here, but you can pull them out like this. It's just a little 4x4 square gauze. We use these a lot in the medical field for cleaning wounds, packing wounds, things like that, making dressings out of them. So you'll take a few of these and you're going to get them wet. Preferably with normal saline. So let me pause here for a minute and go to the book. So normal saline is what you're going to get in the hospital if you're going there and you're getting an IV. It's basically salt water. It's got the same salinity as the fluids in your body. So it's very good for cleaning wounds. It's good for IV, for rehydration. Now, you're thinking in an SHTF situation, where am I going to get normal saline? Well, that is a good point. And Dr. V addresses that. I'm going to read a little section here where Dr. V tells you how to make normal saline from household things. So I'm just going to read the recipe here. So what you need for non-sterile normal saline. Non-sterile normal saline is what you would use for cleaning a wound. Sterile is what you would use for IV fluid. And we're going to talk about that too. So for non-sterile, first you clean a 1 quart jar or 1 liter jar. You need a cover for it and a teaspoon. For normal saline, you place 1.5 teaspoons of plain salt in the jar. For half strength saline, you use 3/4 teaspoon of salt. We will be using normal saline, full strength. So you'd use 1.5 teaspoons of plain salt in the jar. You fill the jar with clean, boiling water. You cover it and you let it cool. You use this for cleaning and rinsing dirty cuts and drained abscesses. So that's really all there is to it. And then when they say cover it with a jar with a lid, preferably you're probably looking at a mason jar, like a canning jar. Now for sterile saline, you use the same recipe, but you use canning jars with new lids. You use salt that is intended for pickling, the kind without any preservative in it, preferably bought in a Western country. The water must be bottled distilled water or filtered rainwater and collected in a clean container and free of all dirt and organic matter. Sterilize the jars and lids with boiling water and sterilize the spoons before measuring the salt. Make up the normal or half-strength saline as for a non-sterile solution. Seal the jars immediately after adding the boiling water. Do not break the seals until ready to use the contents. Any leftover must not be used as sterile unless it is re-sterilized. That's from Dr. V, how to make normal saline. So, back to the thing. You take some gauze, you get it wet with normal saline. Now, you want to clean that wound, and you can take that saline and pour it over the wound and just rinse it out and flush it out. But you want to get under the edges. If you look underneath here, there is some area underneath here where it's undercut underneath here. Sometimes you'll even get tunneling where you'll get like a deep, if you think like a bullet wound, where you have a tunnel down through there. And you want to get in there and clean all that area out too. Now, with a wound like this where you have this undercut, or if you have a tunnel, which this wound doesn't have, I wish it did, you're going to have to pack that when you're putting a dressing on it. And I'm going to show you how to do that. But if the wound is clean and it's healthy looking, what you're looking for is what's called granulation tissue. And if my editing skills are very good, I'm going to put a picture in right now of some granulation tissue, and you can see what it looks like. As you can see, it's red, it's vascular, it's got blood flow to it. It's got a pebbled look on the surface. That's that new growth coming in. It almost looks like a golf ball with the dimples on it. That's what you want. That's granulized tissue. It's got granules in it. That's new tissue growing. And that's what you want to see in this wound bed. You want it granulized. And these edges like this, you want to keep them up when you do your dressing change. You don't want it to roll under like that, because what they'll get is something called a pibble, where that skin cell, that tissue will roll under and it will attach to itself, and you'll have that rolled edge, and it will never fill in and it'll never close. And you'll have to go in there with the scalpel and manually debride that or cut that away to free those edges back up. So it's important to pack under that. If you have a deep penetrating wound like a stab wound or something, you're going to have to pack it as well. But when I talk about packing wounds, this is not like in first aid, where if you have a deep penetrating wound, you're going to pack the wound to try to stop the bleeding. What we want is when the wound channel closes, you want it to close from the bottom like this and just come up like that and then seal off. What you don't want is for that top layer of skin to close up and it'll look like it's closed, but you've got a big open area, and that's called an abscess. What that is a cooker for bacteria. And You're going to have infection just grow in there and grow in there. If you've heard of people having abscesses that have to be cut open and drained, where they have to go in there and surgically cut it open and drain all that stuff out because it'll never heal. If you have an abscessed tooth, you get a pocket of infection underneath there, it just sits there. You can take antibiotics after antibiotics. You just can't kill it all off before it comes back again. So we want to try to avoid that. So the idea when you're packing the wound is not packing it nearly as tight as what you would when you're trying to stop bleeding. You're just kind of loosely packing it. And the idea is when you put that packing in the upper part of the wound, that keeps it from closing up. But you want the bottom part to close up. So the idea is just to loosely pack it. And every day when you do that dressing change, you put in a little bit less, and that wound will gradually close up. That's just for the underpinned areas like this. An open wound like this, that's going to have granulation tissue that's going to build up, and it's just going to scab over and turn into a nice piece of scar tissue there, and it'll heal up. But a deep penetrating wound is going to close up, but you have to close it gradually. So just your normal everyday wound, if you've got it, it's got good granulation tissue, it's clean, you can change the dressing one time a day. If you're having a whole lot of drainage out of it every time you take the dressing off, if it's just covered in drainage, then you probably want to do it twice a day. But a good healthy wound, you shouldn't have to do it that often. So when you do the dressing change, you're going to use some gauze like this. Now, what if you don't have gauze? Well, that's a good question. We didn't always have gauze. Many, many years ago, I've read some old books, nursing manuals from like the 20s and 30s and even into the 40s and 50s. And part of their job was to wash and iron bandages. And Dr. V in her book recommends for missionaries to organize a church group to get old sheets donated because they make excellent bandages. And you can organize and have like the ladies of the church. You could have youth groups cutting the sheets into strips 4 inches wide. So you take those bandages, you cut them into 4-inch strips, and then you roll them almost like you would rolled gauze. And then you can tie them with a string or put a rubber band around them. If they're shorter pieces, then you can overlay them and take a sewing machine and just run a couple stitches to stitch them together and make longer rolls of bandages. And then you have basically Curlex. You can also make 4x4s by taking some pieces of gauze, and the way she shows to do it is to fold them in on themselves so they're double layered, and then stitch like a X across them, and you make a 4x4 bandage out of sheet material or cotton t-shirt. And you can wash those and they'll be clean. You can launder them. Even if they've got blood and stuff in them, you can run them through a washing machine and clean them and they'll be laundered. Now the ironing part comes in if you want it to be sterile. If you just take a bandage and wash it, it's clean, but it's not sterile. If you're going to put it into a wound and pack it, you want it to be sterile. And the way you do that is by ironing it. So you can take a bandage, and if you have an iron with a steam setting, you can turn it up to the highest setting, and you iron it for 1 minute on the steam setting. Then you turn the steam off, and you iron it for 2 more minutes or until it's completely dry. And that sterilizes that piece of cloth from the heat. The other way you can do it if you don't have a steam setting in your iron is you can take a spray bottle of water and spray it and get it wet, and then just iron it with that high heat until it's dry for about 3 minutes, and that will sterilize it. So you can make ahead of time some sterile 4-inch by 4-inch bandages for packing into wounds if you need to, and then you can reuse those bandages. At the end of the day, you wash them, launder them, they're clean. You can iron the ones that need to be sterile, and you can reuse them. Is it ideal? No. Will it work? Heck yeah. And it's a good way to, in a SHTF scenario. And you say, well, what if I don't have an iron? Well, improvise. Get a piece of metal, heat it up over the fire, use it as an iron. That's the way the old irons were anyway. They were old cast iron irons. They'd heat them up by the fire, and then they would use them for ironing. So you got to improvise, but you can if you want to. So you take some gauze, you get it moist, and you clean the wound, toss it, or get a fresh one. Then you're going to take a piece of gauze and get it moist, and you're going to pack it in the wound. So we're going to put it in there, you're going to cover the wound with it, and we're going to pack it up under the edges. And by the way, I'm not wearing gloves, of course, for this demo, but if you're doing this, you want to wear gloves because you don't want to be getting that infection, that bacteria and stuff on your hands. Also, if you have multiple wounds, you want to clean one wound, pack it, dress it, wash your hands, put on new gloves, and then work on the next wound, because each wound could be infected. There's another wound back here. This one may not be infected and this one is. If I handle this one and then I clean it and then I take the same gauze, or I take my hands dirty and I move over here and work on this one, I can carry that and do cross-contamination to a different wound. I don't want to do that. So once you get that damp, moist gauze in there, well then we're going to take another 4x4 or an ABD pad or whatever you need and just put that over top of it and tape it. And the way to tape it is what they call window painting, which is just going around the edges with a piece of tape. I'll just demonstrate quickly. That way you're not wasting tape by like covering the whole thing. You're just putting it where it's needed. So in this case, you put one on the edge here, put another one on this edge, this edge, and then it's good. So that's how you tape it. Now, what happens when you take it off? Okay, you're going to do a dressing change the next day. With a piece of gauze like this, you're going to take this off, and there's a very good chance that this will have dried out, and it's going to be stuck in that wound. So what you want to do is take some more normal saline, pour it over top of it, get it moist again, let it sit for a minute or so and let it soak in there good. Then you remove that gauze. And that way you're not damaging that granulation tissue as it grows back in there. So you just do that dressing change once a day, you should be fine. And then that'll gradually grow. As this starts to grow underneath here and it starts to close up, you don't pack it as deeply. And eventually you'll get to where, if this is all sealed up around the edges, where you'll just kind of lay it over top of it and put your dressing over that way. But you always use moist. You never put dry into a dressing, dry anything. What'll happen is that granulation tissue will stick to this. It'll grow right into it. And then when you pull it off, you're pulling that healthy tissue off. You're going to start fresh bleeding, and it's never going to heal up because you keep pulling all the new tissue off. So always use moist dressing. That's if everything is healthy. What if it's not healthy? Well then, if my editing skills are good, I can show you it's going to look like this. And you see the coloring, it's different. It's not that bright red anymore. It's kind of pink, it's pale, and it's shiny. It's slippery looking. That's like it has a film on it. Well, it does. That's called biofilm. And that biofilm is bacteria. And we got to get that off of there. It's not going to heal up well if you have that. So if you have biofilm, then what we want to use is an antiseptic to clean it instead of using normal saline. And the antiseptic of choice, what I would pick, is Dakin solution. Now, Dakin's was a British surgeon back during World War I. And after World War I, you had a lot of people coming home with horrible wounds. And the medical facilities in the United States weren't much better than they were after Civil War. So, or the War of Northern Aggression, if you choose. So, if you lived in a big city, you might have a close hospital and a doctor. But if you lived in a rural area in the country or up in the mountains or out on a farm, you probably did not have access to a doctor. You definitely didn't have 911. You probably didn't have electricity, and certainly no ambulances around. So you were going to have to go home and treat these wounds yourself. So Dakin's was a surgeon, and he wanted to come up with a way to treat these good for all these soldiers coming home. So what he developed was something that is named after him called Dakin solution. He did it with a French doctor as well, and I can't remember his name. His name was kind of taken off of it later because he was in some kind of questionable practices, and so they kind of took his name off of it. So it's Dakin solution now, and it's a sodium hypochlorite solution, and it is made out of bleach. Sodium hypochlorite is the main ingredient in bleach. So he wanted to develop a good antiseptic that could be used with normal household things that people would have in their house. And Dakin's is an excellent antiseptic. It will kill fungi. It'll kill antibiotic resistant strains of bacteria. And it's fantastic for that. It's also a very strong antiseptic for cleaning your house and stuff. So if you do have somebody that comes in with some sort of an illness, and like I said, it'll kill most bacteria and viruses. So if you do have somebody, a situation where somebody in your house is infected with something, and you're trying to keep the house clean, trying to kill it all off, disinfect stuff as stuff's coming into the house, then You can make some Dakin solution and wipe everything down and clean it with it. So Dakin's designed the solution to the highest strength that he could without irritating the tissue. And that strength is called full strength Dakins. And that's what the CDC recommends to use for antiseptic when you're cleaning things. But in my experience, full strength Dakins is pretty irritating to the skin, especially the healthy tissue around the edges. So if you have a situation where you're using Dakins and you're starting to see a lot of redness and irritation around the wound, you can take some petroleum jelly or Vaseline and just smear it around there and coat that skin. And that way when you're putting that Dakins on it, it's not affecting, it's not touching the healthy skin, and it'll keep it from getting so irritated. But really, instead of using full strength Dakins on a wound, you should use quarter strength Dakins. That's a much better choice. That's what I usually see prescribed, and that's what a lot of doctors use. Now, the beautiful thing about Dakin solution, if you go and you have a surgery and you come home and the doctor orders you Dakins, you can go down to the pharmacy and get it, but you can also make it at home, and it's a heck of a lot cheaper because that's what it's designed for. And there's 100 recipes online of how to make it. It's the same recipe, but different doctors' offices and stuff will put it out. I used to have one from the University of Virginia. When I post this video, I'll find one and put it down in the description link. But I'm going to just go over it briefly and tell you how to do it. So what you're going to need is some sodium hypochlorite, 5.25%. That's bleach. Just regular Clorox bleach, not the scented bleach and not the concentrated bleach. Most of the bleach you get nowadays is concentrated. It's a much higher percentage than 5.25. It's like 13 or 14%. And it's thick. It's almost like gel-like. And you use just a very small amount of it. The old bleach, you used a whole cup, when you put it in your wash. The last time I've bought it, I got it at Dollar General, and it was in the cleaning products, and it's labeled cleaning bleach. But if you can just find regular old unscented Clorox, flip it around and look at the ingredient label. The first ingredient should be sodium hypochlorite, and you're looking for 5.25%. Now, I've used 5%, I've used 6%. That's fine. That's not going to hurt anything. What you don't want to use is 13 or 14%. That's the concentrated. That's just too strong. So try to get the 5.25 if you can, or someplace close to that. The next ingredient you need is sodium bicarbonate, which is baking soda, which you probably have in your house. If you don't, when you go to the dollar store, go ahead and get you a box of that for $1. And you need some clean water, and you need a pan with a lid. And that's all you need to make Dakins. So to make it, you add 32 ounces of tap water to your pan. That's 4 cups. Then you boil it for 15 minutes with the lid on. That's to keep it all from evaporating off. Then to that mixture you add a half teaspoon of baking soda. So just a little bit of baking soda to the mix. Then for quarter strength Dakins, you're going to add 24 mLs of bleach, 24 milliliters of bleach. For English measurements, that comes out to 1 tablespoon plus 2 teaspoons. And that's how much bleach you add to the concoction. And that gives you quarter strength Dakin solution. Then you put it into a jar, preferably mason jar, and you let it cool, and you wrap it in aluminum foil. And the reason for that is that light will break it down. So you want to wrap that jar in aluminum foil to keep out the sunlight out of it. When it's open, it's good for 48 hours. And then you got to toss it out because it starts to break down and the components start to separate. If it's unopened, you can store it unopened, room temperature for 1 month, and it's still good. But make sure and wrap it with aluminum foil, keep it out of sunlight, and it'll be good for a month. So you make up that Dakin solution. It's a good antiseptic, and you use it just like you do the normal saline. You take your bandage or your 4x4 gauze, you get it wet with the Dakin solution, quarter strength, and then you clean the wound. You clean it thoroughly. You get as much of that biofilm and stuff off as you can just by cleaning it. And then you're going to toss that. You're going to get a fresh gauze or dressing and get it moist with the Dakins, and then you're going to pack the wound. Exact same thing that you would do with the normal saline with a healthy wound, except now you're putting this antiseptic on there, and you put your dressing over top of it, and you tape it up, and you're done. I'm saying taping because this is a butt. If it's an arm or a leg, you're probably going to want to wrap a bandage around instead of putting tape, and you bandage it that way, either with a rolled bandage or with some Kerlix like this. If you do, and then if you do that, you can put some Coban over top of that, and that's very good. It'll keep some compression on it, and it won't come off if it gets saturated with blood or anything. If you do tape a wound around your arm like that or your leg, what you do not want to do is tape all the way around the whole circumference, because once you lock that around there, whenever you have a wound or you have any kind of tissue damage, you can get swelling. And if it swells and you've got that tight tape around there, it actually turns into a tourniquet, and it starts something called compartment syndrome, which that pressure there will cut off blood flow to that area, and then you're going to have more tissue death, and you're actually doing more harm than good. So if you do tape it, don't tape all the way around. Leave an inch or so gap between the ends of the tape so that they can expand if you get any swelling there. So, side note. All right. So you can clean the wound with Dakins, and you can change the dressings with it, treat it just like normal saline. Once you get it clean and disinfected, if it gets to the point where all you're seeing is granulation tissue and you're not seeing that biofilm anymore and stuff, you can switch back to normal saline instead of using the Dakins and finish up the wound that way, and finish letting it heal that way. That's fine. So what if your wound looks like this? This is an infected wound. That white stuff you see is called slough. It's old, dead tissue breaking down, and it fills up that wound. You got to get that out of there. This wound has to be called what we call debrided. All that dead tissue and stuff's got to come out, because it will not heal with all that stuff in there. And so to get that out of there, you can mechanically debride it, which is basically taking a scalpel and scraping that stuff off. It's very painful, very unpleasant. You can also chemically debride it. There are certain chemicals that we use nowadays. We have an ointment tube of stuff that it's called Santal, that we put in wounds, and it will chemically debride the wound. It'll break all that stuff up, break it loose, and it'll come out. But the old-fashioned way of doing that is what we call a wet to dry dressing change. And what you would do is, preferably you'd want to use probably Dakins for this. You could use saline, normal saline, but considering you've got all that bacteria and infection, you cannot get enough antiseptic in there. So cleaning it and everything with Dakins would be better. So, but you would clean it good with Dakin solution, get fresh gauze in, get it wet, and pack it in the wound, just like you do with the normal saline. Pack it under the edges and stuff. But here's the difference. You leave it, and you come back 24 hours and you change it. So now, when you come back 24 hours and you take this off, this is dried out a little bit. And remember, I told you it's going to dry out, and you want to take some normal saline or some Dakins, pour it over it to loosen it up before you take it off, because it's going to be painful for them. You don't do that with a wet to dry dressing change. You put it on wet, you take it off dry. So you leave that, and now it's dried out. Well, what's happened is all that exudate, all that wound drainage, and that slough and stuff has adhered to this. So now, when you pull this off, you're going to pull a bunch of that old junk off with you, and you're going to leave some nice clean tissue underneath there. You may have to do that for several days to get all that slough off of there, but every time you do it, you should be peeling a lot of gunk off on that. Should be a lot of that old slough and stuff gone, and you're seeing more pink and red and granulation tissue in there every time you do it. It's going to be painful, and they aren't going to like it. They're going to complain, "Ow, that hurts." Don't do that. You want to kind of do it slow. The old thing of just do it like a Band-Aid and just rip it off fast. You don't want to do that, because you may actually tear the tissue. This is very sensitive tissue. It's not like your skin. It's pretty tough. So it's kind of tender, and if you just you rip it hard and it's stuck real bad, you might actually tear it and cause a cut, laceration. You cause even more problems, because then that bacteria gets into that. So you want to kind of do it slow and just work it off of there, but don't get it wet. You want to peel it off and get that old junk out of there. Get that wound cleaned up. It's uncomfortable, yes, but in this kind of situation, you don't really have a choice. That's what you got to do to get that wound clean, so that you can get it healed up and get that infection out of there. So that's just some different techniques for dealing with wounds and how to heal them up. Well, last thing is antibiotics, which I haven't talked about. If you have a wound like this, you don't necessarily have to be on antibiotics. I've healed thousands of pressure ulcers, and everybody that comes in with a pressure ulcer and this is not on an antibiotic, because many times the wound is just localized, and using an antiseptic like Dakin's, you're handling the infection right there, and you're killing off that bacteria, and you're getting it out of there. It's not in your bloodstream, it's not systemic. But if somebody does have a wound that's infected and you're trying to get it healed up, it helps a lot if they are on antibiotics. And of course, in a SHTF situation, it's going to be hard to get antibiotics. I've read a lot of stuff online about people taking fish antibiotics or veterinary antibiotics and doing that for human consumption. Of course, that's illegal and could be potentially unsafe. But don't take my word for it. I want to read from the book, from Dr. Van de Curie, what she has to say about that. And of course, this is aimed towards missionaries traveling to undeveloped countries. So I've got 2 paragraphs that I'm going to read, so bear with me. Hey guys, so I got 2 paragraphs. I don't know what happened. My camera cut like the last minute of that video off, so when I was editing it, it just kind of ended. So rather than set up the tripod and everything again, I just grabbed my phone. I'm going to shoot this in. I'm just going to read these 2 paragraphs, and that was the end of the video. So bear with me. Another alternative is to obtain veterinary drugs. In the States, there is good quality control of veterinary medicine, so use in humans is safe, though illegal. They can be bought in farm supply stores without a prescription. If you buy the drug in the States, transport it overseas, and it is not illegal to use veterinary drugs there, you may do so. Many antibiotics and worm medicines are available this way. The filler materials in the tablets are apt to be cheaper than in human drugs and may cause a little stomach upset, but that is the only problem. Veterinary drugs are frequently cheaper than human drugs in spite of the fact that they are customarily manufactured in the same batch and then divided for final sale. There are 2 cautions to be observed. 1 is that the size of the tablets vary widely. You should be very careful to calculate doses accurately. The other caution is not to use veterinary drugs manufactured elsewhere unless you obtain independent quality confirmation of tight quality control and suitability for use in human beings. So that's what Dr. B has to say about using veterinary antibiotics. So thank you for joining me today. I really appreciate you all. This is Hannibal from your medical team, and stay tuned for more videos coming down the road. Thanks. God bless.